Hi everyone, my name is Lalit More and our today's video topic is MedDRA. So MedDRA is a medical dictionary for regulatory authorities, and the definition of MedDRA is a clinically validated international medical terminology used by regulatory authorities and the regulated biopharmaceutical industry. The terminology is used through the entire regulatory process from pre-marketing to post-marketing and for data entry, retrieval, evaluation and presentation. Now we see the scope of MedDRA. The scope of MedDRA can be seen in two ways, like in scope and out scope. In scope, diseases, diagnosis, treatment, signs, symptoms, and therapeutic indications, investigation names and quantitative results, medical and surgical procedures, medical, social and family history, as well as terms of cost art, WH and hearts are the in scope of MedDRA. Now we see the out scope of MedDRA. The population level qualifiers, numerical values for results, the severity descriptions, the drug product term, patient demographic terms, and device failure terms are concluded in the out scope of MedDRA. Now now we see now we study deeply about the MedDRA. So what is MedDRA? MedDRA is a clinical MedDRA is a term used by MedDRA is a software or term used by a medical authorities. Now why MedDRA? The med To facilitate the aggregation of verbatim reports into medically meaningful groupings so that they can be reviewed. Means when we gather the ADRs and all this adverse reaction from the patients through various forms like faxes, mails, calls, then we arrange that all the information in the forms like SIOM form, MedWatch forms, and to regulate the information and to validate the information, MedDRA is actually works. In MedDRA, the information is filled in the form of codes. Each and every disease, as well as each and every each treatment to the disease has its own code. Why the codes, not in the direct in the in the language or in theoretical form? That the reason for the codes is for the harmonization, which means there are different languages in different countries. So uh, if we conducting the information from a different region and processing it in a different region, then the person should have to qualify to the other languages also. It is not possible due to the language barriers. Hence the diseases as well as the uh, uh, treatments have the diagnosis have given the various codes which are universal, which means if when we collect the information from one region and the information is transferred into the terms of code, then the information can be studied in the other region or in the same region of the country by the another person who is unable to understand the language in which the information is collected. Then the code helps in that manner because they are universal and the same for all the languages also. Also, to ensure the accurate, unbiased and consistent classification of CRF verbation. Now what is coding? Coding is the process of organizing information into categories which are assessing codes for the purpose of short, sorting, storing and retrieving the data. The process of transferring qualitative data into numerical data that can be entered into a computer file, which means the qualitative data is converted to a numerical data in easy manner to store in the computer as well as to sort out the data for the another. Also, medical coding is essentially the process for assigning formal standardized medical scores to patient medical records. Now MedDRA. Now we study the brief history of MedDRA development. The pre-MedDRA era considered in the pre-MedDRA era, the information is gathered and sorted out manually and has to take a lot of time to sort out the information. After the standardization effort bore fruit in 1969 with FDA's use of postcard coding symbols for the thresholds of adverse reaction terms dictionary. For the next quarter country, adverse event coding was dominated by WOHAT, WHO adverse drug reaction terminology required by European Union, and COSTART required by FDA, Food Drug Administration. In 1989, UKMCA, Medicines Control Agency, identified the needs of single medical terminology to support new computer databases, which means in 1989, UKMCA, the Medical Control Agency of UK, identified the need to identified the need to a single medical terminology for each and every to support a new computer database, which means after that the globalization take place and the data is collected from all over the world for the sorting and storing process. Then for the language removing language barrier as well as time consumption, we need a single medical terminology for the disease which is same all over the world. In November 1903 to 1994, Working Party reviews and amends MCA terminology, now called as MedDRA. That means in November 1993 to 1994, the MedDRA was developed under the MCA terminology. Now, thank you.